take lots of photos because photography, I think, is key to self-improvement and key to who you are, like, you showcase your portfolio, things like that. I think key skills, I think you just have to develop in dentistry because it's just such a stressful environment, is really resilience, determination, and just like mental toughness. I think you really need that. Like if you go into dentistry with this sort of mindset that, oh no, at the smallest thing, it's gonna be hard to do.
Hi, CPD Junkie Dental fam. I'm your host, Laurence Doan, and today we are joined by Jonathan. He graduated from UQ in 2016 and over the years pursued his interest in dental implantology through postgraduate training, completing a graduate dip in dental implantology, currently completing a master's research project in dental implantology at Aston Uni, completed a 1-year implant externship program from New York University. He is committed to staying up to date with the latest advances in field and completes more than 300 hours of education annually on dental implantology. He has received extensive training from renowned leaders in soft and hard tissue reconstructions. CPD Junkie Dental Podcast is about connecting with passionate Australian dentists who are improving themselves and have attended various CPD courses. My aim is to find out for you the best CPD courses around and what they did to help get them to where they are today. So you can consider doing it and becoming the best dentist you can be quicker. Hi, CPD Junkie fam. I'm your host, Laurence Doan, and today we're joined by Dr. Jonathan Ng. Dr. Jonathan, welcome to the show.
Hi, everyone, and thanks for having me, Lauren. It's a pleasure.
So tell us about your CPD journey or dental journey so far before we dive into dental implants, which is your main focus for today.
Well, I guess my CPD journey really started for me in university, for everyone, I guess. And honestly, for me, myself, I actually personally didn't really like dentistry for most of my uni time. So from almost year 1 to year 4 during dental school, I really did always complain actually about, dentistry as a profession to my peers and my colleagues. So I think them seeing me, being more passionate about dentistry post 5th year is really a bit of a shock to them because they would always tell me about the days where I told them I want to quit. So I think it's pretty funny. So I guess that's really where I started with, my education journey in a sense, because for me, the turnaround time or the period where it really changed for me, I think was around 5th year, the transition. I think 5th year really for us anyway at UQ was very clinical and more hands-on. And during that time when I graduated in 2016. It's probably not as popular now anymore, but back then social media wasn't really Instagram for us. It was actually Facebook and also just websites and blogs in general. And one of the more famous organizations back then was actually Star Italiano. And the only thing I could relate to back then as a 5th year student doing the procedures was really just composites and how to do composites really well. And Star Italiano back then was like the bomb, that's how everyone would talk about and imitate. And I would always read all their blog posts and all their Facebook posts, and it was really cool because it really opened to me a window in dentistry I never saw. I always thought dentistry was just what uni taught me. I never really knew the big wide world out there, and that Star Italiano and them really gave me a view into how cool dentistry could be and how much more it really was other than university. So that really started inspiring me. And then finally my first ever true non-uni CPD course I think was actually with Anthony Mack during my 5th year of dental school. And it was a composite course, and he just held it at the local ADAQ center. And once again, that really opened my eyes up because I said, "Whoa, this is amazing that you can do all this." I never learned any of this in university, and they told me so many or he taught me many really cool techniques I didn't even think was possible. So then I think from then I was like, oh, well, there's actually so much more to dentistry than I really thought. And from then that really inspired me to go further and learn more. So I think that's where my CPD journey really started. And then from there, I guess in my very first year, as you mentioned, here I am now, with a main focus more in implants and things like that. And a lot of people ask, I guess, how did you get started in implants? And it really was a fluke. I mean, as you said, as I said earlier, with how I started, I actually really like composites. I really wanted to do, really nice composites. And, my first implant course wasn't really anything. I never really came out and said, I want to do dental implants and, this is what I really like. I actually went to my first implant course because my boss at that time in my first year basically, asked me to go, and I went along. And I went to course, and, they made it look a lot easier than it really was. And I wasn't confident yet. So I said, I want to learn more about it. So I did, at least 3 implant courses before I even placed my first ever implant. So, it did take me quite a while. And, once I put my first few in, it was fun, and I enjoyed it. And from there I said, I want to learn more. So then I started doing more and more courses. And I guess that really just sort of kickstarted my journey in a sense towards, developing that pathway into implants.
Right. Yeah. I mean, it's a pretty big jump, right? Going from composites to implants.
Yes.
I mean, obviously a lot of clinicians that we talk about other bread and butter dentistry along the way, but could you explain maybe that little jump from there?
Fair enough. That does, I see what you mean there. Well, even in my first year, I guess I never actually really did many implants. I probably only did 3 in my very first year. And then in my second year, I think when I did courses, I never really had in mind, I'm not really doing the procedure so much, so I'm not going to do that course. For me, I think it was just I just like to learn, so I'm just going to learn anyway, and I'm just going to trust later, it'll come, if that makes sense. I think a lot of time as well, when you paid for a course, you're not only paying for the skill, but you're paying for the motivation that comes along with it. I'm sure many can say that after a course they're extremely motivated. So the motivation factor was big. Every time you go to a course, even if I'm not doing the procedure, the more I do, the more motivated I get, the more the more into it I become. You almost basically develop that from going to more courses. So even though I wasn't really doing many, I still went for the education. And then I guess in my second year, I did more. And then I think for me, which a tip later on is I'm going to give is, obviously I like to take photos, and I always tell everyone to take lots of photos. So when I take photos, I always show my photos as well. So I think my peer group or my colleagues around me eventually sort of gathered that I've been doing more implants, and they sort of, in a sense, trusted me a little bit more. And then they said, oh, why don't you come and help us? Or why can't you give us some guidance? So I went from I can't remember the figures, but went from 3 to probably 20 plus in the second year. And then in my third year, I think that's my first ever sort of referral came, in the sense that one of the implant company reps actually asked one of their clients to ask me for help. So then I went to their practice, and then basically, I basically had my first sort of referral, and then it sort of kickstarted from there, in the sense that other owners or other group practices would ask me to come into their practice to help them place implants. And then that sort of became more of a thing and snowballed. I think that's right. Brief generalization of how I got more and more into it. As I said, it wasn't really I didn't force it. It wasn't really by choice. It sort of that was just a journey that came, I think, just naturally, in a sense. But not that I didn't want it. Once I did the CPD, I wanted it more. I wanted to do implants more. I was like, this is actually enjoyable. I do like this. It's fun. and then I went down that path, if that makes sense. And again, my composite dream. So
okay, so let me rehash a little bit. So you're unmotivated, and then in uni, in your final year, you come across Facebook, and it introduces you to the world of style Italiano. You're seeing amazing composites. And then that's complemented by the fact that are you going out, or is the school providing you a CPD course to attend Anthony Mack? Because you're in right?
So that was also a huge opportunity. So I think I was only like 3 or 4 students that managed to reply to that email. You know, and I was free at that time as well. It was just all matched up. So it's not like the whole cohort got to go. You know, only me and like 3 other people got to go, and I think that really helped.
Yeah.
And from then I actually went to another 2 more with ADAQ before I graduated. So I think the new grads nowadays, they're really intense. And I know some of them are already doing CPD, you know, before they graduate. But, you know, for 2016, I think I was pretty good already, you know, doing a few. So I was pretty like stoked with the fact that I got to do some for free. Before I even graduated. So I think I mean, just on that point, I think it's very you know, the university student bodies are definitely a great ground for, you know, graduates or students or even future dentists to be, you know, learning. It's like, even my own experience, my student body at Adelaide, we were organizing Sahil and to come in. We had Lincoln come in and then just talk and give CPD hands-on workshops and stuff like that. So I think it's an amazing eye-opener to what else is available outside of just the course. So that opens you up. You know, you attend Anthony Mack's one, and that's just game changer for you. That opens you up, and you attend other composite courses. So at this point, you know, when does this photography start to kind of kick in? Because you mentioned that photography was something that you were slowly starting to introduce, and that's not cheap, by the way, at this point. Yeah, like, yeah. So I always did want to take photos, and funny enough, what truly inspired me to really start was back again to the Anthony Mack course, because after I did that course, I saw that he was bringing in Javier. I'm not sure if you know Javier, but he's with he's a key opinion leader for GC, and he actually helped develop the Essentia, GC Essentia composite, and he's from Spain, I think. Yeah. So he's part of the bioemulation group, and he's a very big guy in terms of you know, what do you call it, ELAB and things like that. So I saw that he was bringing him in, so that ever since then I remembered his name. And then I never got the opportunity to go to that course because, you know, it's very expensive in my first year out, and I was like, yeah, that's probably not for me, it's a bit too advanced for now. But a couple of years later, he was running online what do you call it, online like teaching webinars. Yeah. So he did a photography one then too, and that was my first one. And then you know, that guy's amazing. I mean, like he makes his own animations because he had a previous role as an animator in the past. So like when he teaches photography, he teaches to like the core, you know, like he really knows it. Like he's so good. So, you know, I was really inspired by that. And then funny enough, as I said, that was just sort of I knew him because of my first course I did with Anthony. And then that inspired me to, you know, get my own camera and start taking photos. And yeah, I just basically, you know, followed all his advice and got my own camera and went from there.
Yeah. And so you started taking photos, and this is how you kind of get more kind of case acceptance. You kind of seeing things that you maybe not have had the time to see just if you were just doing the checkup and clean really quickly. And then you're slowly starting to incorporate implants into your practice. So how does this kind of come about? Is it that your mentor, the practices, you had a mentor there that's kind of helping you out with it? Because obviously, you know, there's no real implant courses as we, you know, graduate, right? As in, sorry, let me rephrase. We don't learn implants hands-on per se at uni when we graduate. So how do you kind of incorporate that?
Oh, for me, it was actually really hard because I never really had a hands-on mentor like right next to me showing me how to do what. So it was tough, and how do I say, a lot of people are quite blessed if they do have one, so it makes your life a lot easier. And so I think for me, really, I relied on asking the people around me questions. So I never really had one mentor where I asked all my questions to. So, for those of them who have mentors out there, be grateful, because it's great to have one. And so when I how I learned was basically messaging the specialists around me, and having a group of people I could just message and show x-rays to, show photos to, message the people who I did courses with, and ask them about what would I do for this case. And it's sort of piecing the puzzles of the jigsaw puzzle yourself, in that sense, to find out. So yeah, in that sense, it wasn't the smoothest journey. It takes more work that way. Yeah.
Yeah. So how did you pick the implant courses that you're attending to, further your study on this?
Yeah. So at first, I didn't pick knowing what to pick. I just did whatever, in that sense. And I guess this is part of my vice, because now in this day and age, especially in 2023, the problem is not that we don't have enough information. The problem is actually we have too much information, and that's what is a big issue. And it's not about like, oh, can I get information? It's more about clarity about what information is good. And I think that's a big reason why dentists nowadays are doing a lot more. And then you hear dentists that in the older generation, they say, wow, for 30 years of my career, I never placed implants. And then these new grads now are placing implants like 2 years out. Like, that's crazy, right? But I think it's also because of the fact that 30 years ago, you didn't have the internet. You didn't have like, a billion times more webinars and resources and just accelerated courses. Back then, to learn implants, you had to fly to, Sweden or whatever to actually learn how to do it.
Yeah.
So now it's like the modern day athlete, like Usain Bolt. He can run 9.58, compared to the previous record holder 40 years ago who only ran a 10 point. Like, technology develops. Like, you can do CPD at home now, like, on your own like model, so it just, all this innovation and technology just accelerates your learning so much. And with that comes volume. As I said, there's so much learning out there. As you said, how do I choose? And I think at the start it's really okay, because as a new grad, like, any course is almost good in the sense that you're going to learn something, right? But as you develop further in the pathway, you want to learn and you want to be really good at something. I think it's good to have clarity of what's good. So my philosophy to that is really go to the source. And I always say this to my friends and colleagues, because if you imagine knowledge like a waterfall, right? The person who made up the technique or made up the procedure or has done all the research knows the most about it, right? He's the one who developed the technique, does it a billion times more than anyone else. So he's what I call the source. And then the source of knowledge from him falls down from the waterfall and then goes into the river and the creek. So from me, I've always went to the source. I've always said, who's the person who developed the technique? Who's the best at this? And I just go to the course and do the course. And that's just simple as that. It doesn't have to be the exact best, but you get my analogy. It's just got to be a top tier educator in that sense. And you can compare that to someone who's learned that technique from them and taught that course, because I've sat in both courses, and there's little nuances or little bits of that they miss out, which is critical. So I always like to say, like, if you want to be the best at it or be really good at something, it's really important to learn from the top tier educator. Like I'm saying, if this is not for all of dentistry learning, like, if you want to really be advanced at what particular path, like, if you want to learn how to do like just general dentistry, that's like, doesn't matter almost. Yeah. So it's more for the advanced pathway as you go further. I would say, if you want to be really good and know more about something, going to the source is a really good fallback in terms of choosing your education. Yeah.
I mean, for a lot of graduates, when they come out, they may not know the source because they're not familiar with all the names, right?
Yes.
they'll have to attend something, maybe like a weekend course or something. And then there's like a mention of it, but then they might see the mention, but they don't actually think that's an actual person that's still alive. They're thinking that, that's someone from, decades ago, right?
Yeah, yeah. That's why I said, yeah, as a new grad, I think it's hard to know that. I think when I like how I did it was basically every single name I heard, I literally Googled. I was like, well, who's that guy? Who's that guy? And then just followed the trail. But it is hard. So I don't expect new grads to really know that. So I'd say that's later in their career. At the start, I think anything is good. Like any education is good for your career in the sense that you're learning. You know what I mean? Yeah, it's more if they want to be really good at something.
Yeah. And is this what leads you down the path of going into the grad dip as well, or?
Honestly, for me, the grad. Okay, so that's the difference, hey, because a lot of people the structured learning, like you do 1 year course and you do a lot, and then there's short courses. So for me, to be honest, I never really did the structured learning, and even really the grad dip came way later in my career. For me, it was actually doing these 3 days to 1 week courses from different educators. So literally I went to learn the best technique from Istvan van Urban, then you learn it from Otto Zur, then you went to learn it from Sasha Javonik, and then you learn it from Danny Boozer, and then you've learned the best technique from each best educator, and then you sort of amalgamate it together, and that's where I learned it from. So for me, it wasn't that I did one massive 3-year course and then that's it. For me, I just did a lot of shorter quality courses in that sense. Then after that, I was like, well, it's still good to have a title, right? So I was like, I just did the grad dip. So the grad dip for me really was just having the title in the sense, but I still really enjoyed it because it's a very research focused one, and I actually enjoyed the research process. It's quite fun. So
yeah, because I mean, like you said, they may not have a lot of these course patients that might come through straight away to implement everything that they're learning. So how would you kind of communicate that to a recent graduate that's like these weekend or 3, 4, 5-day courses where it could be thousands of dollars, and maybe they may not get that back straight away, or soft tissue is definitely a big leap in one sense for a recent graduate who are maybe 2-3 years out.
Yeah, so that's what I would say about. Actually, I missed some part of my advice out is, as a new graduate, all my first courses were actually communication courses. So I think that's the number one thing you should focus on as a new graduate coming out in courses is, I think I did like at least 4 to 5 communication courses, and I bought all the books, so I think that's highly important. You can't do what you said without having the communication background.
Did you say you bought communication books?
Yeah.
So what kind of books would you be willing to drop?
Oh, well, I mean, I bought Ashley Lader's book. He's a guy from the UK, and I also bought Frank Spear, The Art of Case Acceptance. He's very good, and I don't know why, but his book went from $30 to like 150. I have no idea. I think he's maybe stopped publishing or whatever, but yeah. They're both really good books, and I really do enjoy both of their techniques. So and then I think what works really well is if you have a case that is right after the course. So you line up, like you almost go to the effort of lining up a case after the course that you learn, because that is the best of both worlds combined. Like you get 100% optimization of your learning if you do that, compared to if you do the course and you don't do it for a while, which is poorly optimized. You learn best if you line the case up after the course, 100%. I
think that is definitely one of the things that I find as well with recent graduates, where they might be going out to go learn and upskill, but they don't actually have the patient base to kind of complement it, and so then it doesn't become utilized. It just becomes knowledge, but then it just fades.
Yes. That's very true. With that being said as well, I guess in that sense, I would advise to, at the start, not to focus too much on one, because like, even though I said like I did do that, I don't think it's the best way. It's probably better to shotgun it and then just work out what you really like and then go down that pathway that suits you.
Yeah.
Because I think later on we're going to talk about it too, but what doesn't really work well, like what courses, so
Yeah.
yeah.
So, I mean, how does Aston University's or New York University's externships, or how does that all kind of come about in the grand scheme of things?
Well, yeah, it for me, it was really more of like the finisher. Like, I've all gathered all the knowledge, the hands-on experience, and then really at the end, then it is like, here's really like a structured postgraduate title in that sense. So for me, that was my what do you call it? My organization of how things went. And I know people put that first, which is fine. And I don't think there's one exactly right way to do it. I think all ways work, whether you do that first and then do other things later. So I think for me, that was just like, it's not the end of my, but it is toward like the later part. Yeah. Because education never ends,
Yeah. I guess it's one of those things where it's like you take away something and then you apply it, and then you realize that even if you were to go learn it back again, you'll still take something else away from it.
100%. Yeah, 100%.
So graduates also talk about, how do I pick the right implant system, especially if I'm an associate at dental practice?
Yes. That's a very good question. And I'm very biased about this, to be honest, because obviously I do education myself, and I do speak for 2 implant companies in particular. So with choosing your implant system, I think the number one thing, okay, there's no number one thing, there's a few things. I don't have an order, no specific order.
Yeah.
It's random. But staying as non-biased is number one. I would say, having support from the company, and having true support, not like, some companies can be really salesy and you can sense it, like really aggressive, really salesy, pushy, and they don't give a damn about like, what you end up in later. Like they just want to sell. So I think it's really important to find a company of really good support. Then also, I think it's important to know, like, ask other clinicians about their experience, because a lot of times on surface level, implant companies may be very attractive for particular reasons, because their workflow is so simple and very, very easy to use. But if you ask more people, deeper insights on their system, you might find out that there is not as easy as it seems, and it might be more complicated. So I think 100% you should, ask other clinicians about their experience, and one who's used it, a fairly medium amount. Also, choosing an implant system that I think can cater to you as a, starting out, in terms of having some simplicity helps a lot as well. And I actually really like to collect. I really like to collect implant clips. It's really weird, but I have a stack of them. So I make it into like this Christmas tree, So I had the blessing to almost try, a lot of them out there. So I guess speaking from experience, it is those are the important points I found, useful to me.
Yeah. Would you say that there's no one right implant system? Like, I think in my own journey, I find that you can't just buy one. Like, you hear about guided, non-guided, you realize that you end up buying more than one kit to complement both kind of to complement your implant journey.
So for me, I've developed my protocol nowadays is actually have one drill kit for any implant system almost, and it's basically me using the Versar osseoidentification kit. So I think I have like 6 of them, and like they're small little things, and they're really, really good because they're tiny, right? It's not a big thing. And basically I can use that system for 99% of my implants. In the mandible, it doesn't really work as well, but I don't use it in reverse. I use it in forward to cut. And then whatever implant you want to use, you can just use that drill, but then use that implant system's driver to put the implant in. So in that sense, that is my universal kit. So that it's not an implant, but it's an implant drill universal kit. So that's how I approach it.
Yeah.
Yeah. I mean,
Secret's out.
and I mean, I don't, speaking in a non, are we recording this whole thing, or?
You can tell me to pause if you want.
Well, if we pause, I'll talk to you in a personal level of what I think I really like, but I don't want it to seem biased for everyone. So
No, that's fair enough. Let's talk about another aspect. So, you are a part of so many different study clubs, ADA, ITI, ASID, IOCI, you're a part of the Australian Osteo Integration Society. Can you tell me about picking a study club and why joining a study club might be also good?
Yeah, I think picking a study club, having a study club in general is just really good already, no matter what it is, because it's just an opportunity to network with your peers and your colleagues. And, you just meet people and you connect with people, you just learn so much, and there's just great topics out there. So, when I graduated in my first 2-3 years, I made an effort to almost join as many study clubs as I could, like, as a guest or as a member, just to, learn more, because it's all CPD at the end of the day, and you're meeting people as well. So how to choose one, it's hard to say unless you like a particular topic. I know there's, general study clubs that, to cater for everyone. So I guess it depends on, the individual. Like, if you're a general dentist and you just want to learn everything, then just join a general study club. There's quite a few like that. I mean, implant wise, yeah, I love the AOS because that's what it's all about. It's about implants, and being part of the committee, I really like that as well, because it gives me an opportunity to organize events, and I really like organizing events. So yeah.
So I mean, outside of just implants, you do like oral rehabilitation, oral surgery, soft tissue, that kind of stuff as well. Can you talk to me about how you kind of went into that kind of aspect of dentistry?
Oral rehab, I'd say, is not really something I do as much as implants. Like, I do it comes along, but it's not a huge focus. How it came along, I think, honestly, a lot of patients that need implants also need oral rehab. So in conjunction, you need to do both. And, that's where I actually got a lot of my oral rehab cases, rather than someone coming in needing a pure oral rehab with no implants. That was definitely a lot rarer for me. So I think that's where I got the cases from at the start, because they needed implants and then they needed oral rehab as well. And you're just going to do it at the same time, simultaneously. Yeah.
And is that were you doing anything to complement that in terms of understandings of occlusion,
Oh no, 100%. Yeah. So I did heaps of courses on that as well. Yeah, like I didn't do just implant courses. I did a lot of other, like, general courses at the same time. Yeah. A lot. Yeah.
Are we talking like weekend kind of courses? We're talking other long courses?
Both. Yeah, I did some online module ones as well. So occlusion design, that's a big online module one. And I did, almost watch a lot of Frank Spear's work. Yeah, so I went to a lot of rehab courses as well, which are a few days. So it's sort of amalgamation of everything as well. Yeah. But I didn't do like a restorative degree or anything like that. No, I didn't. Yeah.
I mean, with digital dentistry becoming so prominent nowadays, right? How how has that been for you in terms of, because when we were graduating, dental dentistry was not that big.
Yes.
And it's just kind of exploded.
Yes, I love digital dentistry, and I really do think 3D printing is the future. So I'm actually a really lazy clinician. I always like to find the shortcut. So I love shortcuts. So for me, like 3D printing, when I saw that, I was like, oh, that is the answer to everything. Like everything becomes easier. So just today, I actually sent a message to my friend. I said, this is really bad. I'll show you if we want to record this. But I said, hey, you're spending the money on the wrong thing. No more composite courses. I said, everything goes into 3D printing from now on. I said, because, why you want to spend 6 hours doing composite chairside when you just print it out, right? But I was like, yeah, this is the way from now for me. When I saw that, I was like, all my money is going to 3D printing. I'm learning 3D printing to the max. So
yeah, I mean, because that's a thing right now. So I mean, how are you kind of learning that and complementing that to your?
I'm just getting into it. I'm not really I haven't gone into it too much. I actually only went to my first 3D printing course like a couple of weeks ago, and I'm just starting my journey, so I'm pretty fresh still in 3D printing, but it's fun and it's amazing. So I really do think that is going to be the future of dentistry, honestly.
Yeah. I mean, as an associate, I mean, do you find that it's helpful? Because obviously some associates would feel like the practice owner should invest in that it shouldn't be me or whatnot.
I'm actually on the practice ownership side, actually. So it's awesome because it helps the clinic. So yeah.
Well, I mean, we'll dive into that as well then. So, I mean, before we get into that though, so as we alluded to a little bit earlier, what were some of the biggest challenges in your dental education, and how did you overcome it?
Challenges, So I think in terms of challenges, obviously everyone can't, unless you're a super GP and really talented, you can learn everything, but everyone, no one can really learn everything, if that makes sense. So when I started out, I tried to learn everything because I wanted to know a lot about everything, and I thought it's important to know a lot. So, which it is, and I did everything. So as part of my journey, I did PRF course with the inventor Shukran. I did ortho course. I did ortho. I started an ortho residency thing. Started the whole first week. I signed up for that. Tried to do sleep apnea, and I think that's the three biggest things that I failed on. The three biggest things I failed on. I really never got into sleep apnea or ortho or PRF. It was just too hard for me. I think one, for the patient base, and two, it's almost impossible to get good at everything. Well, you want to focus on implants and rehab and composites, no way. So I think you got to really focus on one or two max things that you find enjoyable, and then learn that well before trying to learn everything at once. I think at the start it's good to touch upon everything so you know what's possible, and then pick a journey you enjoy and learn more about that. So I think for me at the start, my struggle or challenge was not really knowing what was my niche or what I really enjoyed, and just struggling to develop more in areas that I really tried hard to develop. I think at one point I was trying to tell everyone that had sleep apnea. Your story got sleep apnea. I think we need to make a OSA. I mean a MAS.
Yeah.
I never made one. So
well, I mean, because for a lot of graduates, they probably come out and they'll look at the senior dentist, and then they're doing everything under the sun, and there's I need to be like that. So I mean, to your point, maybe it might be, because we're so early in the journey right now, it might be that this is the aspect you kind of focus in on now, but then later you might touch up on those other aspects.
Yeah, I think it's completely fine. You don't need to do everything well. And I think honestly the trend where it is going nowadays is people pick their niche and just pick one or two things they do really well. And it's another random philosophy, but I say it's like an option A and option B. Option A is you just focus on one thing, you do it so well that you just so good at it, and you can go really, really far with option A. Option B is you shotgun it and you're really good at everything, but you're not the best. So at the end of the day, you fall short of like, I guess, like
difficult
really,
cases maybe, or
really excelling down. Yeah, like for example, like the TikTok guy who just does one thing, like, what do you do for a living? And that's all he does. And that's, he just went so far in life. It's like a really, really sheer focus, I guess. So I think it's almost better to focus on one thing rather than do everything at a mediocre level.
yeah.
if you're a dentist that it's finding it hard to do everything really well, I'd just say just focus on one thing and do that really well. But not discouraging those people who are just so good that they can do everything really well. If you can do everything really well, please like go for it. Like, that's perfect.
Yeah, we're all different types of humans.
Yeah.
So as a clinician, we all reach a point where we start to contemplate practice ownership, being a specialist, or being a super dental GP, or even starting to think about, a family. Can you share your thoughts on that? As you've alluded to, you end up down the route of practice ownership.
Yeah, look, that's such a hard question to answer because, everyone's such in a different situation in life and there's so many different factors. But I think you can't do what you do if you don't really have like, true passion, or you really enjoy what you do. You're just gonna stop halfway. So I think, it's sort of, you got to look at all the factors, like, family, like how important is family and having kids, versus, your career, and whether one can come first and one can come later. And, some people are just really dedicated to the cause and, they just do one thing really well and they become a super GP, or, just a dentist who's really good at one thing and they can go all the way. And that's fantastic. So I think you just got to ask yourself really well, like, where do you want to be and is it really worth it? And, is it worth the sacrifice? Yeah.
Yeah.
For example, practice ownership, right? Like not everyone, like a lot of people might do practice ownership for the wrong reasons, like many people say, like autonomy, or because they see other people doing it, but if you don't enjoy it, then don't do it. Like there's probably a lot better ways to achieve what you want to achieve without doing ownership. Like if you want autonomy, you can probably find a practice which gives you autonomy. If you want finance, well, like, there's heaps of other avenues of finance. But if you truly like business for what it is and just like that, then that's perfect. So I think you really got to just dig deep and ask yourself, what do I really enjoy? What do I really want to become? And, I don't think everyone has that answer right off the bat. And I don't myself. I'm always asking myself that question every day too. So yeah.
Yeah, I don't want to throw you on the spot, but yeah, a lot of people are clinicians primarily, right? But they don't have a business background. So how do they know if this is a
exactly
thing for them or not?
Yeah, 100%.
Yeah. So, so these were the questions you're asking yourself. Basically, you're thinking, am I going to be able to do it? Is that what you're saying? Like, you're just like, sorry, I'm putting words in your mouth, but, what would you say, because you're alluded to, you're diving really deep within yourself to kind of figure out if this is for you. So what were some of those driving factors for you?
Oh, for myself, right. Oh,
Yeah.
for me, I've actually always, like, before I was a clinician, I actually really liked business. So that was me before I even did dentistry. Like even back in high school, I was reading, books on that. So I really, like, that was already a passion of mine. Yeah. So for me, it was sort of a no-brainer. Like, it was going to be there one day. It was just something I really thought I would enjoy. So that's why I went for it. Yeah. But for, I guess, a different individual who might not like that idea, then yeah, it's sort of like you go really ask yourself. Like being a clinician, honestly, was a big surprise to me. I really did not expect myself to be a clinician. Like in my head, as I told you, in dental school, I didn't really believe in myself much. I was actually thinking in my head, I'll probably just refer my crowns out. Like I'm so bad at doing crowns in uni. I was like, oh, I'm just going to refer them. Like, I'll just get someone else to do them for me. You know what I mean? Like that's how far away I was.
Yeah.
I really was a different path than I expected. So
Yeah. If you could talk to yourself, your younger self,
Yeah.
now, right?
Yeah.
So what are some of the biggest challenges that you faced when opening up your practice, and how did you overcome that?
Um, Biggest challenges, I would say, um, I would, this is a good question. I would think that dealing with the existing patient base was a big challenge because the existing patient base, it was an older dentist, so it was a takeover. So older dentists have different treatment philosophies, and just changing the mindset of the patient to modern day dentistry, I think it was a challenge and still is a challenge. I would say that was my biggest challenge. Changing the style of dentistry, not just in the patients, but also in the equipment and everything. I would say that's the main and biggest challenge for us.
Mm-hmm. And so how did you kind of overcome that? Did you have to, was it a slow grind, or,
a lot of education to the patients, I guess. And I think bringing in new and modern equipment also helps. Like, the patients who have been an older dentist, they'll see the new modern equipment, but, oh, wow, that never even knew this scanner existed, or, wow, you can 3D print. That's insane, like, and they're like, oh, no wonder, maybe that's why they do things differently now. And, just having an intraoral camera already, like, people thought we're like, living in the future. So,
yeah.
I think like that really helped to communicate. I think photos, like showing the photos, like really helped to explain and get over the different treatment philosophies of past and present.
Yeah. I mean, don't get me wrong. Like even today, sometimes when I'm taking intraoral photos, like intraoral camera photos, people are thinking, are you taking an X-ray? And I'm like, no, this is not an X-ray. I'm just taking a photo.
Yeah, exactly.
Okay. So how do you go about building your team of staff and associates? What kind of qualities do you kind of look for when hiring a new employee?
Yeah, look, I think the biggest thing I think staff wise, someone that is, very, actually both open to learning. I think that's a big one for us. Like, they want to do more and learn more. They're actually passionate about learning, because learning is actually one of our core beliefs in the practice. Part of our our practice, how do you call it, our practice values and goals. So learning and always learning, I think, is great. And then having initiative is fantastic, in the employees. And then in dentists, I think just having the drive or to want to learn, and being passionate about dentistry, I think is a big, key factor. And also not just saying they are, because I think a lot of people say they are passionate, but they don't show it, because everyone is passionate when you graduate and you write on your resume. But like if I see something that shows they're passionate, like action, I think that speaks really loud. For example, if they said, I've done like 3 courses already, and I got a camera, that's like, wow, this guy's like actually passionate.
Hired.
Yeah, basically, yeah, like they're they're very, and also very and open to learning. I think they've got to be very teachable. Like a lot of people are very stubborn, and you try to teach them something and they don't want to adopt that method. It's hard to get along, hard to progress. You hit a roadblock, or they don't want to learn. You'd be surprised how many people don't want to put the time in to actually do some self-learning. So like, for me, if I give someone a book, right, and they go home and read it and then bring it back, and like, I'm done in a week, I'm like, that's it. That really shows that they do want to learn.
Yeah, then you got to quiz them, right, to make sure they actually read it and not returned it within a week.
Sorry?
You got to quiz them, otherwise they're gonna come back with
yeah, exactly. Yeah, that's a good point. I didn't quiz them. Gonna go back and quiz them now.
So clinically, what's been the most interesting case that you've ever worked on, and what did you learn from it?
That's a really good question. Most interesting case. Um, mm, I think for me, the terminology is slightly different. For me, the most interesting case is what I call the career case.
Yeah, sure.
So for me, the career case would be like something that I have to almost like chuck everything that I ever learned into it. So for me, there's this case where I really had to adopt all the principles I learned from all the like masters into one. So as I went along, I was like, oh wow, I'm so glad that I learned this to adopt this approach. I was like, wow, I'm really truly like bringing everything together now. Like, I felt like the union. I was like, oh, this is great. So it was a really atrophic maxillary case. So, I adopt the principles of, horizontal guided bone regeneration from Stefan Urban, and then adopted the soft tissue techniques that I learned from himself and, Otto Zur and, Zucchelli and Charlotte Javonik and all the courses I went to. And then also Myra Steigman, and sort of like that case really required the skill from all of them, because I used basically their technique from all of them. And then for me, I think that's what made it my like most interesting case, because I felt that I got to bring everything together. So
no, that's fair enough.
I
mean, to your point, like I guess if there was I thought you were alluding to the fact that you might have hit some challenges, but because you had learned something elsewhere, you could implement there to
exactly. And it was almost like as I was going along, like it was a 2-year long case at least. So during that 2 years, I was learning. So I was like, oh yes, finally, I could learn this and do that. And I think that helped a lot.
So, I mean, I guess you kind of alluded to it already. So how do you kind of stay on top of the latest advancements and technologies in dentistry?
At the moment, probably Instagram, which is a bit sad because I'd like it to be more than that. But I mean, most of the techniques I see nowadays on just social media, to be honest, I think social media is just really taken over like learning in dentistry. And, a lot of people say, oh, you can't learn from social media and stuff, but I mean, you can't really learn, but you can get inspiration and know what to do, like, oh, you can do that. Like that is possible, so then you go find out how it's possible. And I think that's what, how that led me to, like, for example, I saw a post on Facebook and this guy was like doing prep same day and then printing out the temp same day, doing like, what do you call it? Live designing, as in like designing was happening live as he was doing the prep. Like he did prep, scanned the top arch, did the bottom arch, and while he was doing the bottom arch, the top arch was being like designed like on spot. And then I was like, whoa, that's actually possible. That is very cool. And I was like, I really want to learn how to do that. So that's my journey at the moment. Actually, I'm trying to how do we achieve that? How do we get to that 3D printing level? So
just another realm to dive into, hey?
Yeah, exactly. Yeah.
But has there been any particular CPD that you didn't feel that you could implement or was not as beneficial for you at the time?
I didn't implement.
Yeah.
Oh, 100%. So like, like PRF, I just could not implement. Like, it's just too much of a roadblock for me to, do, to do that chair side and, just getting the equipment and telling the patient and taking the time, to do that was just really hard. So I never really implemented it, even though I did multiple courses on it. So and sleep apnea, like I could never really implement that into the practice.
Who has been your biggest influences in your career path so far, and why?
I would say it's probably Dennis and Stephen. So Dennis Tarnow and Stephen Chu. I probably look up to them as my biggest source of inspiration and like mentor. He's like, I think he's a how do I say, he's an OG, in his field. Like he's a legend. He's just a legend, like you can't get more legend than him other than the creator of the implants himself. So I think he's really, really look up to the both of them, and they're able to communicate complicated concepts in a simple manner. So I've always looked up to Dennis and Stephen. Yeah.
No, that's fair enough.
Yeah.
On this journey, it sounds like, most of it's been on a fairly good high, but have there been any particular struggles that in your journey so far that some of our viewers wouldn't have known about?
Struggles. I can't think of any main struggles or setbacks. Really that are major. Might have to get back to you on that question. Actually,
that's fine.
That's mind blank on that. Yeah, because I have a question on that one.
Yeah, a lot of graduates are looking for mentoring.
Yes.
You already said it, alluded to it already with some of the people that you would like to be hiring and stuff like that. But what would you say to them in terms of that aspect of mentoring? People look at it, learning from being a fly on the wall. Some people learn it from, having their hand held. Some people learn it from, frequent pep talks.
Yes. As in like what's best, or like what's the best way to achieve mentorship?
I mean, just what your thoughts on it for recent graduates in terms of when they're looking for mentoring.
I think everyone wants mentoring, which is fair. And I think that they need to also put in a lot of time as well to I think having the perfect mentor is like the dream, right? And it's having like an amazing mentor. Sometimes there could be a negative in some other areas for whatever reason. I don't know, maybe income or whatever, but if your income's really high, maybe if you're in a rural area or you're working for a corporate or something, maybe you don't have mentorship. So it's really hard to find the balance where you want really good mentorship and you're really good in work environment. It's like the dream job. It doesn't exist, right? Like if you're searching for a dream house, like you're searching for ages, you'll never get it. So I think that searching for mentorship is tough, and I wouldn't rely on that, if that makes sense. Like, it's awesome if you get it, but it's not the end of the world if you don't, because it's incredibly difficult to find good mentorship and proper mentorship. Like talking like they put their time in to actually teach you, like they take that time out of their own work, sit beside you and go through cases or teach you stuff. The mentorship that most people do which is completely fair. I'm not saying this is bad or anything. It's just oh, here's this case, or like here's this case, like halfway during work, and what do you think? It's like, oh, just do this, do that, or have a quick pop in and have a look. I think most people do that, and I think there's a bit of a expectation difference between what new grads might want and what's offered in real life. So I think mentorship is the goal, but not the everything. So don't, I guess, go into a job just expecting like the best mentorship. It's very hard to find. If you do get it, that's amazing. So like, you are lucky, and you are so lucky. And
yeah, I mean, one of the things when I talk to people like recent graduates that ask me that question, I always tell them, you just got to be transparent about it. You got to be open to talking, communicating what it is that you're after, and maybe sometimes you won't know, but after you go through a bit of it, you have an idea of some of the things that suit your style. So maybe, like I was alluding to, you might be just a fly. You don't actually need them to be there all the time, but you just need to be able to observe them and then ask them questions, and they have to be willing for that. And if they're not, then it might not be the best kind of pairing. Or another sense is like you want them to be able to step in and help you out. But if you don't communicate to them, that's what you were looking for, they will never know.
Yeah, 100%. So like, it's even better, I guess, if they ask, what sort of mentorship do you offer? But even then, you never really, I guess, like it's never really like, it's different in real life. to saying it, you know. So it's very hard to find amazing mentorship. So in a sense, I think I did it the hard way, you know, just learning. And I think in also another way, it's a good way too, because, you know, paid education is sometimes get good education, you know.
Yeah.
So yeah.
So what would you say your current week looks like? You know, the type of procedures you might be getting up to or stuff you might be doing?
Yeah. Oh, sorry. Can I just say one last thing is, that's why I love people. I don't think you should rely purely on mentorship. I think you need both. Like a lot of people think, oh, perfect, I got mentorship, I don't going to pay for actually like CPD. I'm just going to rely on mentorship. That's not the way to go. I think you should 100% like do both. Like, yeah, a lot of people think mentorship is the only way like to learn, and they rely on that, and it's bad because you can't learn everything from mentorship. You need to put in some effort yourself. You know what I mean? Like if you give it stuff, you got to put some in yourself. Like you can't just be on a magic carpet and whoo, you know, just doesn't work that way.
It's not going to be spoon fed to you.
Yeah.
You have to actually demonstrate that, okay, yes, I'm willing to learn, but actually go out and
do it and learn and yeah.
And you know, add to it.
Yes, because some people expect to be on this magic carpet where they go, and it's just, unfortunately, for 99% of people, it doesn't work that way. But you know,
yeah. And I think a lot of people don't realize that until even when they start doing these long-term courses, like long-term courses, that it's not, the information is not just going to be spoon-fed to you. You actually have to go out and find it yourself. Like it's no longer like university.
Yeah, exactly, 100%. Yeah.
So back to that question, what is your current ideal, like, you know, week looking like, you know, the type of procedures you might be getting up to or stuff that you might be doing?
Yeah. So just some clarity. When you say ideal, you mean like I wish it was like that, or what I'm currently doing?
Both. I mean, what are you currently doing, and you know, what do you wish you would be doing?
So I'm currently doing around about 2 days a week of just everything, all up, and then about 3 days a week of more predominantly implant dentistry. What I wish we were doing is probably some more 3D printing, you know, doing some 3D printing veneers and some 3D printing rehabs. You know, that's just so cool at the moment for me. So I wish I'd be doing more of that, mixed in with some implants, of course. So pretty simple for me in that sense. Like nothing crazy. Happy to just do straightforward cases. Honestly, I don't want anything. Yeah.
And I mean, are you planning on attending other particular courses to complement that, or are you just looking somewhere else for it?
I think at the moment we're in the test trial phase, like actually just doing more prac to just work it out. And then from there, I'll figure out, I guess, you know, what we're lacking in, and then find a course or something if we're not really lacking, you know, if we're not doing that properly to try to learn more about that at the moment. Yeah. But it is hard to find, I guess, 3D printing, because there's so many variations out there. So it's not, you know, it's not booming at the moment. I think, yeah.
And, you know, what would you hope to do on your non-clinical days, I guess?
At the moment, I really don't have that much time, honestly, between, you know, practice ownership and then running the society for the AOS and, you know, running our own education courses and things like that. So I don't actually have much non-clinical days, but what I hope to do is probably, you know, exercise more, enjoy, like do more physical activity. You know, what I do on my days off is I do enjoy hanging out with my friends and watching movies, you know, going hot pot and things like that. So that I'm happy with that already.
Yeah. Well, I mean, I heard that you're a big Roger Federer fan.
I am a big Roger Federer fan, but unfortunately he's retired. So for
I was going to say,
it doesn't mean anything anymore.
So who do you enjoy watching and mimicking play now?
So I really don't like Djokovic. So I just want to watch someone beat Djokovic, and unfortunately it's not happening this year. And at the Wimbledon, he's currently dominating. So I'm very upset. I want someone to come along and beat Djokovic at the Wimbledon, and I'll be very happy. And so at the moment, I'm just rooting for anyone that can beat him, and that's it. You know, I just want to see him beaten. That's all. Yeah. So I guess Carlos Alcaraz. Hopefully he beats him, and yeah.
Yeah, you might have to wait another, 2 or so years, maybe.
Yeah, hopefully this year at the Wimbledon. Yeah. I really like Carlos because he had a quote that really, I think I actually said to some people, was when I started this year, which was last year, 2022. He said, I started this year just wanting to break in the top 10, and here I am being the number 1 in the world. And I said to people, I said, yeah, look, you never know how far you can go. So I said, never ever, believe you can't go as far as you'd like. Like, look at that. Like he didn't even think he could, and he got to number 1. So you never know how far, your life or your journey can take into. Like when I was in university, how do I say, I never expected that I'll be so clinical. Like I'll be doing so much clinical. And even when my first year out, I was like, I don't think in my career I could ever even place 100 implants. Like if I got to 100 implants, like that'd be my dream, like done, you just don't know how far you can go. So, that's another piece of advice I'll probably throw out there for the new grads, as well as like along the way, dentistry is almost like a game. And I always say it's like a game, it's pay to win. So you got to pay, you got to invest, and investing in education is never ever going to give you a downturn. It's not like the stock market. Investing in education is always going to be helpful for your career. So I always tell everyone, you got to pay to win in dentistry.
Yeah. As someone I listen to as well, he says, it's not about investing in the S&P, it's about investing in the SME.
Oh, I love that one. That's great. Yeah, that's awesome. Yeah.
So do you have any words of wisdom for the budding young dentist? Some things about the key skills or attributes that they should focus in on or developing?
That probably was part of my words of wisdom in terms of investing and paying to win. Other parts of probably is take lots of photos, because photography, I think, is key to self-improvement and key to who you are. Like you showcase your portfolio, things like that. I think key skills, I think you just have to develop in dentistry because it's just such a stressful environment, is really resilience, determination, and just like mental toughness. I think you really need that. Like if you go into dentistry with this sort of mindset that, oh no, at the smallest thing, you're not gonna, it's gonna be hard to do a lot, because every day some patient or someone's going to set it off and set you off like that. So I think you just got to build up mental toughness and resilience. It's like a sport, it's like tennis, like Djokovic, in the toughest moments is where he shines. And it's just like dentistry. You really got to hold it in together because it's like a roller coaster sometimes. You just really got to have that mental fortitude.
Yeah, I don't want to put any words into your mouth, but I definitely do think when I think about dentistry and being a passionate dentist, it is about kind of being like an athlete. You got to look after your body. You got to, put the hours in, the practice in, just be laser focused, and all of that above.
Yeah, 100%. Yeah, it is very, very similar. Yeah. In practice. Focus.
So Dr. Jonathan, there's so many more questions I actually do want to ask you, but that's all the time we've got for today. I want to thank you again for coming on the show. But if you can let the people know how they can find you or what you've got going on in your life.
Yeah, I guess you can find me just on Instagram, and we also running education events for dentists. So on my Instagram, on the bio link, Dr. Jonathan Ng, you can find, courses that we run as a education company, because we want to bring in, for me, I think from my journey, I obviously met a lot of, great clinicians and great educators, and I want to pass that on as well to everyone. So, the goal is really to bring in really top level education into Australia and, teach, let people learn from these people, the best. And so, if you want to find out more, that's where you can head towards to know more as well.
So we'll definitely leave in the show notes below. So for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie Dental Podcast. Thank you.
Thank you very much, Lauren. Appreciate it.